The mammography group had implemented a variety of really important fundamental operational improvements. But we could see, despite that, in our dashboards, our Black population was not having the same outcomes as a general population.
I think there was an aha moment for us when we realized our work that we've been doing for a number of years, the impact just wasn't being felt. You'd have to listen when you hear patient stories.
As a breast cancer survivor, my experience with mammography screenings before this process was that it was always a very daunting and nerve-wracking situation.
We know and we feel that the community members are the experts when it comes to what works best for them, right? So I think that is key in why we want to design and work and partner with our patients rather than creating solutions for the patients. That is how we're being inclusive. That's how we're trying to be more equitable when it comes to bringing in the different perspectives and voices that maybe we, usually are not including.
The bridging of the community is something that I think has been the first clue. Having interest in terms of, sharing the materials that we develop, these beautiful materials, having interest in folks wanting to take these materials into the community, and that sort of interest in terms of sharing this messaging. That certainly was like the most immediate thing.
This is an investment, and it just feels so validating, and it reinforces the potential long-term sustainability of us as a collective. This trajectory that it is on, someone is seeing value in it, not feeling like we're just talking.
Envisioned it being something different. I envisioned it being more superficial and more like being talked to, and I didn't expect to be in a group of people who were like-minded. That was the fun part, because it was like, I was thinking the very same thing that she was thinking and saying, and there were patients there, there were other family members there were clinicians there, and it was an environment to perpetuate positive change.
The biggest thing that I learned about this process is just the importance of silo breaking, not only within an organization, but also being able to begin breaking down silos that may exist between like a health system and the community that they serve.
Our charge is really to not just use this project as the starting and end point, but really thinking about how we can carry it on, and carrying it on really being thinking about expanding beyond just cancer screening.
So much of our work involves improvement methodologies and performance improvement, and one of the concepts of it is piloting and trying things. And so this was a great opportunity where we got to say, let's try it, and we did it. And I hope and I think, in speaking from my experience and the work that we continue to bring forward with our value-based care team, that we continue to adopt that, both the values and the experience of bringing community into our meetings, giving the power to actually be at the design table with us.
I see the AHS way as having two components. We want to now see equity as a process and an outcome. We're very accustomed to seeing equity as an outcome, comparing populations, seeing what they need. Equity as a process is really the way we're going to move forward.
And I look now at the PFAC and how marvelous that is. Where does that happen? How does this even become? But for amazing people like James Jackson, like Jan Robertson, like Minnie Swift, like Angela Dean, like Noel Belton, those amazing people and all the people that have been part of this process, they're a gift, and we are blessed to have them in the roles that they're in and to invite us to be at the table.